So the Nurses' Health Study is a study that started in 1976, many years ago, and this has allowed data collection on people who don't have diseases, and we follow them to study chronic diseases, and in this case, particularly in women. This is actually very important because prior to this, most of the research was conducted with men as the subjects, predominantly white men. So in terms of equity, this is a very important study considering across genders. So one of the strengths of the nurses study is that nurses have a deep understanding of the different metrics that they were collecting. You saw in the video things like cardiovascular disease, diabetes, different things that some people might not understand, nurses did understand. So they were able to respond with a high degree of accuracy. They were relatively easy to follow over time because they were very motivated to participate in this study. They wanted to help healthcare and the healthcare practitioners to establish exposures or behaviors that could help their patients in the long run. This study helped to determine linkages like cigarette smoking and its linkage to heart disease, which is cardiovascular disease, and then also things like postmenopausal obesity and breast cancer. It looked at the impact of diet, and one of the great things about this, because it is a cohort study, a longitudinal study that has been going on for, let's see, 35, 45 years now. They are now looking at third generation. So we can look at the original nurses and their exposures, and then we can see if their daughters or their daughters' daughters were exposed, or if they changed things, if that had an impact on the outcomes. So some of the strengths and weaknesses of cohort studies. Well, first of all, they're ethically safe. We are not asking people to do something that might be harmful. We are allowing people to make their own choices, collecting the data, and then finding out if certain behaviors, if the people who chose those behaviors were more likely to get the disease or not. And because of this, we're able to establish the timing of exposure. Again, one of the criteria for causality is that the exposure happens before the development of the injury or illness. This is very important, and because we have people that don't have the disease and we follow them to find out who develops the disease, we can establish this timing. Another strength is that the researchers are allowed to develop their own criteria or measurement, so to speak, of the exposure or outcome. So you get to define packs of cigarettes per week that would make you a smoker or defined as a smoker, maybe how many fruits and vegetables someone eats, or if they exercise. The researchers are allowed to operationalize each of these variables. And then you are also able to look at those confounding variables that we've talked about. So these are the strengths and weaknesses of cohort studies. We will now look at randomized controlled trials.